Okay, welcome everybody to another episode of the Community Health and Capital Podcast. I am hugely excited to welcome today our guest from the other side of the pond, Susannah Fox, author of the Rebel Health book, which I think came out in February this year, Susannah.
Yes, it did.
This is, I think, our first inter-Atlantic podcast. I think it may be our first international off the top of my head as well. So thank you so much for taking the time to come and speak to us, Susannah. We're really excited to hear from you.
I'm thrilled to be here. I think what you're doing is really intriguing.
That's really kind. Thank you. So just tell us a little bit and give us some glimpses of what have you done before? Why did you write a book and what's it all about?
The through line of my career is the democratization of information that technology affords us. I built websites in the 90s and then became a researcher. I was looking at the social impact of the internet and technology on American society. Very quickly, I saw the potential for how healthcare was going to be transformed. That again, this democratization of access to information was starting to happen in the year 2000, and it accelerated, and it's accelerating even faster now. And I think it's a good thing. I am a technology optimist. And what I also believe in is that one of the most powerful things about technology is that it can connect us to each other, not only to information, but also to each other. I brought that philosophy to my work as a researcher and to my role in the Obama administration, where I was the chief technology officer at the US Department of Health and Human Services.
You got to me first. I was about to bring that in. I think literally about there to be, and I think you've got a lot of experience to share, don't you, Susannah?
Yes, and yeah, it's been wonderful to you reach an age where you're able to look back, and I always tell everyone tells a good story in retrospect and about their career. I could never have predicted that learning HTML in the 90s would lead me to where I am today. So, follow your curiosity and you never know where you'll land.
So what made you write the book though? Because it must have been a recent idea.
So, for many years, when I was a researcher, I would start a research project by conducting field work in an online community of people living with rare diseases or life-changing diagnoses, because I got advice from a mentor that if you want to see the future, that's who you should hang out with. You should hang out with the people who are pushing the frontier of medicine. And I would observe how they were using technology, how they were interacting with data. And then I would field public opinion surveys to test how many American adults were doing the same activities. And because of that work, I had the privilege of collecting stories from thousands of people over the years. And I felt a sense of responsibility for how many people had shared their stories with me. The other experience that I had is as I got invited into higher level conversations, being invited to speak at NIH and the White House, and then eventually taking a role in the Obama administration, what I saw is that my friends who worked at the highest levels of government and the highest levels of, corporate mainstream healthcare often didn't believe me when I would tell them these incredible stories of innovations at the kitchen table and at the bedside and at the grassroots. And so I wrote this book as a way of introducing my two groups of friends and colleagues in healthcare. I wanted to introduce the pioneers and the rebels, the patients and survivors and caregivers. I wanted to introduce them to my friends who, frankly, are in the power positions and make sure that they know that their mission is aligned.
No, it's really I think reassuring to hear. And yeah, there's something very curious about, I think, the disruptive agenda of technology meeting what I think you're getting across, Susanna, in the book is the human relationship story, and the fact you talk about a patient-led revolution. Do you see those agendas as naturally colliding?
It certainly is unusual when people think about innovation in medicine. They think about laboratories, they think about scientists, they think about pharmaceutical and device companies. They think about things that are more like tectonic plates. And what I'm talking about are um, prototypes that are held together with, string and tape, and they might be somebody's idea that also has a lot of power because it's solving a problem for someone. And that at the fundamental root of change is that we're trying to solve a problem. We're trying to solve a human problem that we all share. And so it's often difficult for people who are looking at their budget. Their budget for a federal agency might, be in the billions of dollars. What could a caregiver possibly teach me about healthcare? And what I always say is, you never know. You never know where the next amazing product innovation is going to come from. And you also never know unless you talk to people who you're actually trying to serve with your intervention or your government program. If you don't stay close to your customer, then you won't be clear that you are really serving their needs. So that's why at first it seems unusual to try and bring in a patient voice, but I always say, you just listen, and I'll help you understand how it can really solve your problems.
And looking through and reading the book, Susanna, there's so many powerful stories in there, aren't there? And I'm sure we couldn't do justice to kind of say, tell us one, tell us two, but what are some of the kind of memorable ones that come to mind for you?
Well, I really like to talk about the diabetes online community because to me, they represent, in technology terms, the full stack of the patient-led revolution. They were a group of people living with type 1 or insulin requiring diabetes have to do math every day, all day. They have to calculate the carbs that they're eating and the insulin that requires. And there have been amazing innovations in the past couple of decades around continuous glucose monitors and insulin pumps. But the way that pharmaceutical and device companies have traditionally seen their customer, they've traditionally seen their customer as the prescribing clinicians. And they're not necessarily paying attention to the patients and the caregivers who live with the disease. Well, these patients were really frustrated. And so the first thing they did was they went out on the hunt. They said, this is terrible. This is not good enough. And we're going to see if we can find products and services and ideas that are going to help us. So those are the seekers in the patient-led revolution. They're seeking a better way. The next thing that happens is that people start to gather together in community. And the diabetes online community gathers on all kinds of social media platforms. Um, and they trade ideas, and it's actually very strong internationally. And those people are called networkers, and you really need the networkers because once you find something that works or once something is invented, you need the networkers to spread the word about it. And that happened in the diabetes community. The third group are solvers. Solvers are people who, um, if they see something that's not working, they can't wait to take it apart and put it back together again. And the fourth group are champions. Champions are people who hold access to certain forms of mainstream power. And here I'm thinking about funding, access to labs and manufacturing facilities, access to regulatory guidance, and they share that resource with a patient-led group. But here's a story to illustrate how this all came together. Um, Dana Lewis is a woman who lives with type 1 diabetes, and her continuous glucose monitor, which is a wearable sensor that lets her know whether her blood sugar is going high or going low. She she was using her continuous glucose monitor, and she was living alone, and she noticed that it often took a while for her to wake up. The alarm would go off letting her know that her blood sugar was going low, but the alarm was really not loud enough to wake her up, and this was very scary because if your blood sugar is going low in the middle of the night, unfortunately, you could never wake up. It's called dead in bed syndrome. And so she wrote it to the device manufacturer and said, "Please make your alarm louder." And frankly, they ignored her. They missed their opportunity to learn from a patient. And they said, "No, the alarm is loud enough." But because Dana is a networker, she saw one day a posting on Twitter. It was still Twitter then, from a dad of a child who his child was 4 years old, and that child used a continuous glucose monitor. And this man was John Kostick, and he and his wife would set alarms all throughout the night to stumble down the hallway and check on their child's CGM reading to see if he was in good range. And then if he was, they would try and go back to sleep. And he said to himself, if I could get the data out of the CGM and maybe onto my Apple Watch, that would be a lot easier for me. Because again, the device was designed so that you have to be in the same room with it to see the data. That's not really thinking in terms of the usability for the patient or the caregiver. And so he was essentially able to hack into his son's medical device, free the data, send it to his Apple Watch, and post online how he was able to do it. That set off a cascade of innovation. So John Kostick is a solver and a networker. He shared what he did. And all of this started 10 years ago. Since then, I'm happy to say, champions emerged from the pharmaceutical and device companies as well as the FDA. And now it's standard practice that patients and caregivers have access to the data that's being generated by their own bodies. And that revolution happened because patients and caregivers pointed out that this wasn't working for them. And they forced the public conversation and burst into visibility where they had been invisible before.
It's a compelling story, Susanna, and I think you can hear the disruption alight and alive, at each kind of stage of it. And I think y- we still see often, I think, that the kind of community involvement and kind of public involvement in healthcare decision making is still a large way away from where we need and want it to be. That's speaking on our side of the pond anyway, I guess, really. But I think I think research has moved on a long way, really, hasn't it, in terms of, how involving of who should be the end user, I think, really, it is with it. But I don't think we always see that spilling into healthcare. So how has it been received? It's been out for a period of time. Have you spoken to or heard from any health professionals who've got a take on the book at all?
Yeah, what's really fun is I've gotten to speak to clinicians and hospital executives, pharmaceutical company executives, both here and actually I was in Amsterdam and Vienna a few weeks ago, and I'm happy to say that it resonates with professional audiences. The By contrast, it's very interesting when I speak to groups of patients. It resonates with the patients. They're glad to have language to express the value of what they bring to these conversations. But when I speak at a bookstore or to a general audience, one thing that surprised me is the level of anger that people have, at least in the United States, about the American healthcare system and how people have such uneven access to care. And there have been people who stand up when I give a talk about the patient-led revolution. People say, I came to hear a talk about a real revolution. I want to overthrow the American healthcare system, and that's not what you're talking about here. And I found that very humbling that my book is about um, innovation in treatment and care and devices, whether it's medical or assistive devices. But there's a disconnect between people who are professionals in healthcare and the people who feel like they just are being chewed up and spat out by, at least, again, I'm just speaking of the American healthcare system. And I wondered what you, if you have a reaction to that, like when you talk to people about the care that they're receiving, is there anger or is there complacency?
It's a really interesting question, isn't it, Susanna? I think people often try to kind of sidestep these conversations, really, don't they? Because it starts to get very political, and yet at the same time, a lot of people acknowledge that to be apolitical, to be complicit to an extent, really, in the kind of structural violence, whatever you want to call it, that is happening in our countries day in, day out in lots of ways and lots of guises. I suppose I can understand if I was in your own shoes, Susanna, not to speak for you, that perhaps it's helpful to be a little bit agnostic of those funding regimes, if we can call them, to be fair, really, because I think a lot of what we're talking about should be agnostic to funding regimes, and it should be agnostic to an extent of this is the end goal we want to get to. It doesn't really matter what color or hue of government we have, and it doesn't really matter what funding policy we have for healthcare, because people are going to need healthcare, and if we're going to have a need for healthcare and pay for it however we pay for it, what are the principles we have for it, to be honest, really? So I mean, in 19 Hills, what we're trying to do is to kind of come from the bottom up, grassroots. How do we involve people? I think that's hard because people, if you knocked on doors and said, will you come along and tell your local primary care organization how they should work? People might slam the door in your face and be like, don't know why you're asking me that anyway, really. It's not a very interesting question, right? But it's interesting that it's not always interesting because in Wales, 60% of the entire government budget gets spent on health and NHS, and you cut and slice that up. Most of that goes to hospital care, most of it goes to secondary care, most of it doesn't really go to primary community family care. So it has big consequences. I think we do have to meet people where they are and hear what's important to them. And I often laugh when people say, well, we can't get an appointment with the GP, we can't get an appointment with the family clinic. Um, and then I kind of look at the areas we're talking about and go, really? That's your first question? You'd ask a politician, really, of all the things that affect your well-being? Um, but I no, I think it was interesting before you came on, wasn't it, Susanna? You were saying, there is an element of bipartisanship about these issues, really. And um, I think probably if you strip away some of the politics with the big P, the kind of the politics and the principles around, well, this is happening, whether you completely like all of it or not, the tech, the innovation, that revolution, which is accelerating by the second, really, isn't it? I mean, from what we can see of it, it's very small. Um, it would be really interesting to know kind of what is happening at a national level, I guess, really, governmental levels since you've left that post and where this is going. But the principle of really trying to think around, particularly the kind of inclusivity, I guess, of that patient revolution too. Where do you see this going in the States in the next few years?
Well, right before we started our conversation, I talked about how when I closed out the Obama administration, I was the last CTO at our HHS, and I handed off the portfolio to the incoming administration. It was the first Trump administration, and I am happy to say that the portfolio was about open health data, the idea that all the divisions of HHS collect data, and the American people should have access to that data, whether it's from our FDA or Centers for Disease Control or NIH, that as long as it's anonymized and doesn't expose anybody to privacy concerns, there's a lot of good that can come from open health data. That's bipartisan. That was picked up and actually expanded in ways that I applaud. Um, and the other half of the portfolio was an innovation portfolio, this idea that if we're going to create positive change in our federal government health agencies, we should talk to citizens. We should talk to the frontline healthcare workers. We shouldn't be top down. We should actually be bottom up in terms of the changes that we want to see. And that again is I'm happy to say resonates with Democrats and Republicans. It resonates with leaders as well as the people who are receiving these services. I'll say though, one thing I learned is the you can always get the leaders at the top who are kind of paid to be visionaries, and you can often get the frontline healthcare workers to get in on an innovation. I call it the permafrost of middle management. It's people who don't get paid to be visionaries, who really just need to deliver services on a very tight budget, who don't want to frankly hear about a lot of changes that are coming from above or below. So that's one warning that I'd have. Um, the other observation um, about when the book came out, and I have this very strong title, Rebel Health, and I talk about the Rebel Alliance of Healthcare. It sounds a bit dramatic. It sounds like it could even have kind of a battle imagery. And so someone asked me in a public forum, so who's the enemy? Who's the enemy of the Rebel Alliance? And it was actually a patient who broke in and answered for me. And I loved his answer. And I'll give credit. Ben West, he's a diabetes advocate. He lives with diabetes, as he's an incredible solver and hacker of diabetes devices. He said the enemy of the Rebel Alliance is disease. At the base of all of us, like, we're all humans who are trying to hopefully stay healthy. The other thing that really resonates with a lot of people, I often open when I'm giving a talk, there's my professional bio, but then there's also the real fact in my life that I've been a caregiver for 5 elders in my family. And that's as important to me as any professional experience that I've had. And I have to tell you, that resonates no matter what your political affiliation. Everybody has a grandma. Everybody has somebody in their life that they care for or that they hope will care for them.
Mm, mm. No, I think we do end up dehumanizing ourselves in a lot of these things, really, don't we? Which I think probably alienates us from the people that we're trying to connect with too, at times, really. But well, Susanna, if you were kind of going to kind of an innovation company, or somebody that was trying to kind of do things in the wake of your ideas, in the wake of your directions, whether they're a health professional or a company, what would your advice be? Where would you suggest they start?
I would say find ways to create an intake valve for the ideas of your customers, for the ideas of the people that you serve. Make sure that you don't make the same mistake as the medical device company made when Dana Lewis wrote to them with a suggestion. They didn't have any way to take that in and make a change. So that's the first thing. Make sure that you're listening. And also the other advice that I have is to um, create small experiments where you bring in people again with the lived or loved experience. That's a great phrase that I learned recently. Lived experience means that you have the disability, you have the physical challenge or the disease, or loved experience, which means that you maybe have cared for someone with that. Make sure that if you're creating an innovation, you're going to create an experiment, don't just have people who are part of the company or work at that hospital. Make sure that you bring in people from the community who have lived and loved experience, who are on the design team. Before you even start to ask questions, make sure there are people from the community who are there at the table, not just at the end when it's time to promote the material on social media or in the press, but at the very beginning.
Mm. Well, Susanna, it's just been a huge privilege to have you on the podcast today, and we're really excited to release this to our listeners. And it would be great to have the feedback in 12 months' time or so, really, to kind of see if we can be judged by that litmus test as well. To be honest, really. But if people wanted to go and find the book, I know we're on advertising medium, but where would be they could get it on probably made any major book selling platform, including Amazon.
Yeah, so it's available everywhere as a Kindle book, and in a lot of places you can buy it online. There's an audiobook as well. And if I could just leave you with one last thought, I love to make sure that people know that if you are listening and you are struggling, whatever you're struggling with, there are people who would love to help you if only they knew how to find you. There is no doubt a community, there is no doubt another person like you who has traveled the path that you're on.
A really lovely place to end it. Well, thank you so much, Susanna. We'll make sure we have the links in the podcast when it comes out. And huge thanks for joining.
Thank you.
This was another episode of the Community Health and Capital podcast. If you've got ideas for an upcoming episode, if you'd like to feature on it or know someone who would, please get in contact at info@nightingales.org, and we'll look forward to joining you for another episode very soon. Thanks, Susanna.